Today's question is 56-year-old male presented with hematuria, loin pain and swelling in the loin. Histopathological examination showed the following. CT brain showed cerebellar hemangioblastoma. What's the syndrome associated with this condition? So here there is a clear-cut history which is showing a triad of hematuria, flank pain and flank mass. So this is a typical history of renal cell carcinoma. Now look at the histology. You have nests of cells which is having a clear cytoplasm. So this is a clear cell RCC. Okay. So among the given 4 options, which of the following is associated with clear cell RCC and cerebellar hemangioblastoma? So the most important is VHL syndrome, the von Hippel-Lindau syndrome. Okay. So let us learn about the syndromes associated with RCC. So VHL is due to mutation in chromosome 3p. Okay. And the patient can have clear cell RCC. They can have pheochromocytoma. Then they can have endolymphatic sac tumors in the inner ear. Okay. So this is about your VHL. And they can have cerebellar hemangioblastomas also. Okay. So what about the other options? So you have something called tuberous sclerosis. So what is tuberous sclerosis? It's a neurocutaneous syndrome. So the name is because you have tuber-like lesions in the brain. So what is this tuber-like lesion? Tuber means something which grows beneath the ground, like your potatoes. So what is those tuber-like lesions? You have multiple hamartomas in the brain. What is hamartoma? It's a disorganized mass of tissue which is indigenous to that place. Choristoma is ectopic rest of normal tissue. Suppose you have a pancreatic tissue in the stomach, we call it as a choristoma. Okay. So you have multiple hamartomas, especially near the ventricles. So they will project into the ventricles. So this will give a radiological appearance of a candle guttering lesion. So this again is important. Candle guttering lesion is seen in tuberous sclerosis. So along with this multiple tubers, that's why it's called tuberous sclerosis, you can have something called adenoma sebaceum. Remember, it's a misnomer. It's not from the sebaceous glands. You can have Sjagren patches and you have fibromas in the subungual region, which is called Conin's tumor. This was a MCQ in NEET. So Conin tumor is seen in tuberous sclerosis. And patients with tuberous sclerosis can develop subependymal giant cell astrocytoma. Going to the next option, hereditary leiomyomatosis renal carcinoma syndrome. That syndrome is associated with multiple leiomyomas in the uterus and skin. So if you get leiomyomas in the skin, we call it as a pilar leiomyoma. And here you don't get clear cell RCC. In hereditary renal cell carcinoma, you get something called papillary RCC. Okay, so papillary RCC can be there. And this syndrome, hereditary leiomyomatosis and renal carcinoma, is associated with mutation in fumarate hydratase gene. Okay, so this is about this syndrome. And the last syndrome is Birdhoff-Dubé syndrome. So Birdhoff-Dubé syndrome is associated with mutation in a folliculin gene. So this is associated with multiple skin tumors like acrocordon. Acrocordon means skin tags. You can have something called trichodiscomas, which are nothing but your skin tumors, adnexal tumors. You can have fibrofolliculomas also. Okay, so you can have a lot of renal tumors. You can get any type of RCC, but in this syndrome you have something called chromophobe RCC. Chromophobe means they have cells with abundant eosinophilic granular cytoplasm. So this again is important. So all these syndromes are associated with RCC, VHL with clear cell, hereditary leiomyomatosis with papillary RCC, Birdhoff-Dubé with any type, but most common is chromophobe. And tuberous sclerosis, you can have angiomyolipoma. So this is one tumor which can occur in the retroperitoneum in case of tuberous sclerosis. Thank you.